Maybe you're scheduled for a dental examination, your wisdom teeth have been bothering you, or you think you should have them checked out. Whatever the reason, you will need an examination from your dentist, and today we look at what you should expect from that exam. Hello and welcome to another patient education video. My name is Dr. B and we are continuing our discussion on wisdom teeth. In case you missed them, we have already done 2 other videos specifically talking about wisdom teeth, and I highly recommend that you check those out as well. I will link those videos down below in the description. Today we are looking at what you should expect from the wisdom tooth examination. Most of the time you will be seen by your general dentist and they will evaluate your wisdom teeth. In some cases, they will make a recommendation and continue with a proposed treatment. In other cases, they may actually refer you to an oral surgeon who will evaluate and treat you. If you're medically compromised, require a deeper form of sedation, or are predicted to be a more complicated surgery, then you could be referred to an oral surgeon for those reasons. When you see your dentist for the evaluation, make sure you let them know if you have any medical conditions, take any medications, or if you have any medical allergies. This is crucial information for them to know so they can make sure that you are safe to treat and are well taken care of. The dentist will typically take a panoramic radiograph that shows both jaws, top and bottom, as well as all the teeth. This image helps the dentist see the wisdom teeth and their relative position and angulation within the jaw. It also allows the dentist to determine the development of the tooth, being complete or still developing. It is virtually impossible to evaluate the wisdom teeth without a radiograph. In some situations, the dentist may determine that they want a 3-dimensional image of your wisdom teeth to better understand their position concerning adjacent structures. This 3-dimensional image is a cone beam CT, or CBCT for short. The dentist should spend some time showing you where your wisdom teeth are located on the radiographs they take, how they are angulated, and how close they are to adjacent structures. Your dentist will examine the soft tissues in and around your mouth and your teeth, focusing primarily on the wisdom teeth in the back of the mouth. Some wisdom teeth are easier to see if they have erupted into the mouth. The dentist will determine if the wisdom teeth are impacted or fully erupted. They will look for any signs of cavities starting or already formed. They will take an instrument called a periodontal probe and place it between the teeth and the gums surrounding the wisdom teeth. If they find that the probe measures to a depth of 4 millimeters or higher, they may be concerned about the potential or presence of gum disease. The dentist will ask you if you have ever had any pain or discomfort associated with your wisdom teeth. Ultimately, the dentist has to look at all the information they have and information you provided to start to create a list of reasons why they should remove the teeth. Common reasons for removal include the wisdom teeth being impacted in a position that prevents adequate cleaning and the presence of disease. The benefits of removal should be weighed against the risk of surgery. Your dentist will want to assess the difficulty of each wisdom tooth and plan accordingly. Please make sure that you understand the benefits and risks of wisdom tooth removal. If your dentist recommends the removal of some or all of the wisdom teeth, they will either plan to do the procedure themselves or may refer you to an oral surgeon. Your dentist should also talk about sedation options. Anytime you have your wisdom teeth removed, you will always receive local anesthesia. You know, the stuff that numbs your teeth, so you don't feel what is going on during the procedure. Now, despite the local anesthesia, you may want to talk to the dentist about sedation options to help you both relax and get through the procedure. Not everyone needs sedation, but there are good reasons to use it. If you're usually very anxious going to the dentist, or the thought of having the 3rd molar surgery makes your heart beat a little bit harder, you may want to talk about sedation options with your dentist. Sometimes the difficulty of the procedure is enough reason to consider sedation. The more complicated the procedure, the longer the procedure could take. Sedation could help you be more relaxed and comfortable throughout a more prolonged procedure. In addition to local anesthesia, you have a few sedation options. You could get nitrous oxide or laughing gas. This has the potential to relax you, but it doesn't work on everyone, and it will not likely cause you to fall asleep. Some patients expect to be asleep during the procedure. If your goal is to fall asleep or not remember anything from the procedure, nitrous oxide is not a good option. Another option is oral sedation, taking medications such as Valium or Halcyon before the procedure. These medications do not produce the same effect on everyone. Although they have the potential to make you fall asleep or not remember the surgery, it does not work this way for everyone. The best way to ensure that you are more deeply sedated and will fall asleep and not remember the surgery is really going to be IV sedation. This of course involves having an IV placed and the sedation medications are given through the IV. This more easily allows the provider to provide you with specific doses to get you comfortable despite your weight or response to medications. Compared to nitrous oxide and oral sedation, it is a more predictable sedation. Nitrous oxide is the safest option. With oral sedation and especially IV sedation, the possibility of being oversedated becomes a concern. Your dentist should monitor your breathing during the sedation and be prepared if you become too sedated. Your dentist should discuss sedation options with you, and both you and the dentist should decide on which form of sedation to use. Sometimes the patient will ask me questions about how the surgery is completed. I will also cover this during the examination if the patient desires. Some people just don't like the details. During the procedure, we administer local anesthesia so the patient does not feel anything during the procedure. Any sedation options would have already been started before the local anesthesia. If the tooth is impacted, an incision is made into the gum tissue and the gums are pushed out of the way to expose the underlying tooth and surrounding bone. Some of the bone around the tooth may need to be removed to expose the tooth. The tooth may come out in one piece, or the dentist may decide to remove the tooth in multiple sections. If the tooth is fully erupted, then typically we just push on the tooth a little bit and we use an instrument to remove the tooth from the mouth. After the tooth is removed, the gum tissue may be sutured. A surgery involving 4 impacted wisdom teeth generally takes about 45 to 60 minutes to complete on average. After the procedure, you will have medications that you will need to take for the pain management. Your dentist will go over these with you in detail. Expect to have the pain for at least 2 to 3 days and some mild to moderate swelling for up to 14 days. You will typically have some minor amounts of bleeding from the surgery sites for the first 24 hours as well. If your pain starts to get worse around day 4, after the surgery, you could be experiencing what's called a dry socket. A dry socket is where the blood clot that forms where the tooth was located either dissolves or is dislodged. Loss of the blood clot makes the healing take longer and can make your pain last for up to 1 to 2 weeks after the surgery. Alright, so that will be all for this video. Hopefully now you have a better understanding of what you should expect when having your wisdom teeth evaluated. If you are planning to have your wisdom teeth removed soon, I wish you the best. You will do great. If you like this video, hit the like button and make sure you subscribe if you have not already. Thank you for your time and attention, and I will see you next time.